Thank you for the kind invitation to speak in this symposium. I have no disclosures relevant to the presentation. I will talk about 3 or 4 perspectives, that is global, regional, national, and then personal. So this was a survey that we did on the platform of the Asia Pacific Association for Study of the Liver and the World Gastroenterology Organization. A COVID-19 hepatitis survey that we did in July 2020. We sent this to a lot of respondents in 89 countries across the globe, and we got 170 responses. The questions related to both hepatitis B and C. This was done when we were doing a symposium, a partial WGO symposium, to determine what the effects of COVID-19 have been worldwide on the hepatitis situation in many countries. The results are interesting. So the first question, some of the relevant questions that I've put in, the first one is, do you start new chronic hepatitis B patients on treatment during the COVID-19 pandemic? And most of the people responded to say that yes, they did, but some of them were being cautious, only starting in cirrhotics, for example, and a small minority was postponing treatment till the end of the pandemic or the lockdown. Has the COVID-19 pandemic affected treatment continuation of patients already on treatment? And 30% responded to say, yes, this had led to treatment interruptions in some of their patients. Regarding screening and surveillance of HCC in patients infected with chronic hepatitis B in the COVID-19 pandemic, what do you follow? So the majority of people responded by saying that they were continuing 6-monthly imaging as recommended by most of the guidelines, but at least 30% were delaying their imaging or just doing this with an alpha-fetoprotein level. Regarding family screening of hepatitis B infected patients, there were some who were asking them to visit and get screened along with the patient, but the majority of them were asking them to screen at a nearby laboratory or delay screening until the pandemic was over. So the next question was, what is your assessment regarding the effect of the COVID-19 pandemic on national hepatitis B and C elimination programs in your country? And only about 30% said that these programs were continuing as previously without any effect on the program itself. But the majority said that they had either considerably slowed down or they were not sure of what was happening to these programs. Then we asked, what do you think the goal of the viral hepatitis elimination by 2030 is still achievable or not, considering the pandemic? 40% were very optimistic to say yes, they still think this was achievable, but perhaps 60% were not so sure, or they were sure that this was not achievable. What is your assessment of available research funding for HPV in your country region? And then the significant number said there was a significant decrease or a slight decrease, but some thought there was no change. What do you think regarding national immunization programs for hepatitis B during the COVID-19 pandemic? A good number, about 50% said that the participation was slow or delayed, or the program was getting downsized because of social distancing and other restrictions. So there was at least a 50% impact on national immunization programs. This was the WHO survey undertaken between April and June 2020. Compliments to what we've just what I've just told you in the WGO survey. So they looked at disruption of services as it related to hepatitis, HIV, and STI services. And as shown on the slide, there were countries that were reporting disruptions, including potential stockouts. More commonly, it seems, in the Western Pacific region than compared to other regions, but generally all regions were affected by disruption in services. This looks at it more graphically. So hepatitis B testing was affected in 10 out of the 61 countries that were facing disruptions. And so was hepatitis C treatment initiation in 6 of these. And about 5 or 10 of these countries were showing disruptions in prevention programs like needle and syringe exchange programs, etc. Many countries were reporting the disruption in NCD services. Of particular interest to us, of course, would be the cancer services, perhaps as it relates to HCC. And you can see that when the transmission phase was in the community, this was where the maximum disruption was happening. About 60% of countries suggested that they were facing disruption in cancer services. So this is another regional paper which was published in the Lancet by Gupta et al. Looking at the COVID-19 viral hepatitis response situation in sub-Saharan Africa. First, they pointed out three basic parameters which were important. First, people with viral hepatitis related to liver disease in sub-Saharan Africa are likely to remain undiagnosed or to present at very late stages of disease. Second, for patients already diagnosed with HBV or HCV, substantial disruptions to ongoing monitoring and treatment were now occurring. And thirdly, there are considerable pressures on the health system that will have direct implications for the core interventions needed for viral hepatitis elimination. This is a quick graphic view of the viral hepatitis elimination programs in Pakistan during the COVID-19 pandemic. This slide depicts the Punjab program, which is our largest program. And at a glance, you can see that as the lockdown happened in Pakistan by the 23rd of March, all of these parameters, registration, screening for B and C, enrollment for treatment, et cetera, all had gone down. They started to go up once they instituted some telemedicine mechanisms, but then there were further lockdowns, and this stayed down well below what was happening pre-COVID, right up to July, the month of July. This is our personal experience. This is our CHIME grant microelimination project in the Malir district. As you can see, we were going great guns in February. We screened about nearly 1,400 subjects. This came to zero in April, May, which were the maximum months for the lockdown in our country, in our city. Started to climb up gradually, but even by July, we had not reached our cruising target of about 1,400 subjects. So a substantial decrease in the screening of individuals in these communities. So finally, what happened to the routine immunization programs in Pakistan? This is just taken from a newspaper item written by one of our UNICEF doctors in Pakistan. Full immunization coverage in children declined from 240,000 in January to 190,000 in April. From January to June, a 25% decline in Penta-3 coverage. Between March and April 2020, around 700,000 children missed the Penta-3 vaccination. Similarly, antenatal services declined from 537,000 in January to 345,000. And perhaps this also accounted for a drop in the birth dose vaccination for hepatitis B. If you look at the individual programs, this is the Sindh program. This is all vaccinations, adults and children. So in February 2020, 16,000 first doses were given. This dropped to a low of 1,860 in May 2020 and has only started to climb up as we speak. This is the Punjab program again. Just look at the last right-hand column. 2,601 vaccinations in January in a single center, which dropped down to 224 in July of the same year. Finally, what have the countries done in terms of mitigation strategies? So some countries have been balancing stock levels with a shift to multi-month, 3 to 6 month dispensing, if the current stocks allow that. And this has particularly happened with hepatitis B drugs and C drugs. and also with other services like opioid substitution therapy. So this seems to be one important aspect to mitigate treatment, to mitigate the effects. The other parameter that has worked well are telemedicine and triaging, which have been adopted really, as you can see, across the board, from low middle income to upper middle income and high income countries. Somewhere smaller, somewhere more, but certainly this has been a significant level of engagement with telemedicine deployment. So in summary, globally, there have been major disruptions in the vital hepatitis elimination programs. All components of the program have been affected, including screening, diagnosis, treatment, follow-up, and harm reduction. Vaccination services, including hepatitis B vaccination, have been significantly affected. Generally, viral hepatitis programs have taken a backseat during the pandemic. However, some positive aspects emerge also, such as increased testing capacity, innovative methods of drug delivery and follow-up, and some enhancements of the healthcare systems, particularly in surveillance capacity, for example. With this, I will end my presentation. Thank you very much.